Good morning, everyone, and welcome to our virtual corporate breakfast. My name is Sue Hunt, and it's my great privilege to be the Chief Executive Officer of the Royal Children's Hospital Foundation. Can I begin by acknowledging the traditional owners of the land that we gather on here at the RCH this morning, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. Can I also acknowledge particularly all Aboriginal and Torres Strait Islander people in this, our renewed, revisited, revised NAIDOC Week. NAIDOC Week moved from July to November this year and has the wonderful theme of always was, always will be. If you'd like to visit the RCH 150 website on rch150.org.au, you'll see some great presentations of how we're celebrating Aboriginal and Torres Strait Islander peoples in NAIDOC Week, and the impact that the donated funds have been able to have on Aboriginal health here at the hospital over the years. It's wonderful that so many of you have been able to join us this morning, and I'd welcome each and every one of you, and particularly we're joined by many of our long-standing workplace givers, and so thank you and welcome. We'd love to hear from you all online for today's event, so please use the chat function to tell us your name and where you're from. We're also trialling live captioning today, which you can view by clicking on the live transcript button in the menu bar below. The captions are automatically generated, so they may not be perfect, but we do hope they'll be helpful to some of you. I'd like to welcome our two presenters this morning, Professor Harriet Hiscock, who is Associate Director Research at the Centre for Community Child Health here at the hospital. She's Director of the RCH Health Services Research Unit, which we're really thrilled to be able to support on an ongoing basis, and the Group Leader of Health Services at the Murdoch Children's Research Institute. We're also really fortunate to welcome, albeit remotely, Tristram Gray, Chief People and Capability Officer at Kmart, and you may be able to see him on the screen there now. I can see him on my monitor. So today we're really fortunate to have Harriet here to talk about the mental health of young people and how it impacts on the whole community, with a particular focus on what has occurred throughout COVID-19 over the last few months. Before I hand over to Professor Hiscock, we would love you to ask questions throughout today's presentation. Please type them in using the chat function, and we will endeavour to answer them in our Q&A later on. So now I'm delighted to introduce Professor Hiscock, who will take you through a fantastic presentation. Harriet?
Thank you, Sue. And I too would like to acknowledge the traditional owners of the land on which we meet today. So I'm going to talk a little bit about mental health in children and understanding really the unintended consequences of COVID-19 and the pandemic restrictions, and some where to from here and what do we need to do. So when we think about the pandemic, there's been a lot of talk of the different waves of the pandemic. The orange wave is particularly about people who got COVID, which fortunately hasn't been too bad in Australia. And there's some impact, we know, of what we call long COVID on those people. But what I'm really interested in, and a lot of us here at the Royal Children's Hospital are really interested in, is wave 4. And that's been the psychological impact, the mental and physical health impact, the economic and education impact on children. So there's been a lot of stresses affecting health. There's been school closures and disrupted learning. There's been lower household income, food and housing insecurity. We know that isolation has increased, and family dysfunction and family violence as well. And so when we look at this closer to home at the hospital, the Royal Children's Hospital Emergency Department actually saw a drop in presentations of about 40% across the ED, except for mental health that went up by 36%. We've also seen around this time last year, 1 in 7 parents were worried about their kids' mental health, but during COVID that increased to 1 in 3, and that was data nationally across Australia from the Royal Children's Hospital Health Poll. Not only are we seeing this issue in our hospitals, but Kids Helpline reported a 24% increase in calls in September this year, with 1 in 20 kids who are calling saying that a parent or sibling has become violent or abusive. High school students, especially girls, were calling feeling overwhelmed by their workload. And really, quite disturbingly, kids were reporting that they wanted to die and were running away from home. This is an email that came to me from a colleague who works in the northwest of Melbourne. She said, I recently had an experience where a teenager I started on medication was escalating in distress and self-harm. She presented 3 times to the emergency department and it was eventually put on a list for case management in a public mental health service. But it took a long time, and each time the family had to repeat their story to a different person. I counted at least 8 separate names who I tried to call and find out who was responsible for this family. I really want to see how we can upskill paediatricians, private psychiatry and community-based practitioners to be able to offer that missing level of support so the tertiary, the hospital sector, can have the space to deal with high-risk patients. So keep that in mind as I talk about solutions down the track. I've done quite a little bit of work in mental health over the last years, and this data I'm going to talk to you about is from my work pre-COVID. So we looked at close to 5,000 children from the longitudinal study of Australian children, and we looked whether they were getting help if they had mental health symptoms through Medicare-linked data. So this is visits to GPs, psychologists, paediatricians and child and adolescent psychiatrists. And when we look at the younger kids from age 8 to 13 years, of those who had a mental health problem, between 9 and 27% only were getting a Medicare rebated service. Girls, younger children and those from non-English speaking backgrounds were particularly likely to miss out. We then did a study where I had a fabulous medical student who posed as a parent of a boy with possible attention deficit disorder or a girl with likely anxiety. And she called over 300 practices of paediatricians, psychiatrists and psychologists. And she said, how long until I can get an appointment with you? And how much is it going to cost me after the Medicare rebate? And this was done in April, May last year, so pre-COVID. And already overall a third of the clinicians were unable to offer her an appointment. They'd closed their books for the year. So imagine if you're trying to find help for your child in that sort of scenario. And the table below shows you the average wait times and out-of-pocket costs. And the out-of-pocket costs are just for one appointment. So if you have to attend 10 appointments with your child to see a psychologist, for example, on average that's going to cost you $800. So there's clear inequity in our system. Well, I've also looked at mental health presentations to emergency departments pre-COVID, and we looked at the trends in this over a 10-year period or a 7-year period. And the biggest increases have been in anxiety and depression. We've actually had a 46% increase in mental health presentations to our Victorian emergency departments compared to a 13% increase in physical health problems. We have also done a study where we interviewed 140 GPs, paediatricians, psychologists and child and adolescent psychiatrists, along with 28 families, about what's wrong with the mental health system for Australian children. And if you had a magic wand, how would you make things better? So I'm going to try and show you what's wrong on a simple infographic, 1 page, which is quite a challenge to distill this down. But the very first challenge we have is clinicians and families say they find it hard to know if their child's got a mental health problem or not. Even if they do know, the next challenge is, where do I get help? It's a really complex system to navigate, and even GPs often don't know where to send kids for help. The next issue that we've documented is the long wait times and out-of-pocket costs. Clinicians and families talked about fragmented care. There's a lack of support for parents and siblings and the wider family who are trying to help a child or young person with mental health problems. And as we all know, particularly for kids under the age of 12, there's just not enough care. So what are we going to do about this? And over the last 10 months, I have been working with my colleagues across this campus, which is the Royal Children's Hospital, the Murdoch Children's Research Institute and the Department of Paediatrics at the University of Melbourne, to develop a strategic approach to infant, child and adolescent mental health. We've got 4 key areas of family-centred care, consistent and quality care, research and education and training, with enablers underpinning that. Just to draw out some of those things where I think we can provide solutions to these challenges. In our family-centred care, we want to develop or adapt existing parent and staff mental health literacy resources so parents and clinicians, and particularly GPs, can work out, is this a problem or not? We then want to develop models of care to enable people to know where to refer their kids that they're worried about and how to support them in the meantime. Under consistent and quality care, down the bottom of the screen, we want to develop clinical practice guidelines so clinicians know how to manage these problems, because they currently don't exist for children's mental health in Australia. We also want to have care pathways, particularly for vulnerable families. So here I'm thinking the refugee children, the out-of-home care children, and the Aboriginal and Torres Strait Island children who might be particularly at risk of poor mental health. And we want to take all of this and translate it and integrate it into workforce education and training resources that we can then help to attract competitive funding for as a program of education, not just for the Royal Children's Hospital staff, but staff across Australia. And I would venture Australasia. And we want to underpin this with really good research that drives the evidence of what we do, because we have to have evidence-informed strategies if we want to improve things. So I think what my main message is today is that the current system we have around children's mental health is really not coping. Whilst we do need more clinicians, that's going to take time, and that's our long-term game. But in the meantime, I think we can do a lot to support the existing primary care workforce, and by that I mean GPs and our fabulous maternal and child health nurses, as well as our secondary care workforce, and really in the community that is paediatricians and school counsellors and psychologists. When you look around the world, there's many ways to do this, but most of them don't yet have a lot of evidence. There's one version called Project Echo, which comes out of the US, and Queensland Children's Health Foundation has been trialling this. It's an online multidisciplinary case presentation and tele-mentoring way of delivering support to those frontline clinicians to manage mental health. In the US, there's a Massachusetts Child Psychiatry Access Program. That, to me, is the holy grail of what we could do. This has now been rolled out across 30 states in the US, largely funded by their insurance companies, but also by their local governments. And what this does is it allows access to child psychiatry expertise through email, hotlines, webinars, and secondary consultation. And then if we sort of look at primary care in particular, our GPs, there's models coming out of the UK called GYPSIs, so GPs with a special interest. And in the US, there's a more intensive model of called REACH, which is really trying to get GPs to sit in over a period of months with other GPs and specialists in mental health care. So I've been thinking about these models, and then an announcement came for Victoria only from the federal government and Victorian government to provide support for these new Head to Help community hubs. So these are to meet demand from consumers around mental health in the context of COVID-19, in the hope that we can support people in the community and avoid emergency department presentations, hospital admissions and serious illness. They're currently virtual hubs that opened on the 14th of September, but they're going to move to physical hubs, and they're supporting all age groups. And I think we have a real chance now to work with our mental health service and the North West Melbourne Primary Healthcare Network, which is our GP hospital network, to see if we can develop that sort of model of support and care for GPs and paediatricians and psychologists to upskill them. So who will these hubs see? I don't expect you to read this detail, but basically they're going to span everything from the really mild mental health problems where self-management, direction to a website might be enough, through to what we call high intensity. So that's someone with a diagnosed mental health problem who's having significant problems with functioning, but not enough to warrant a hospital admission. So they really are spanning quite a spectrum. So we're in discussions, the RCH Mental Health Service, my health services research unit here, are in discussions with North West Melbourne PHN, and we're meeting with the state government this week as well to see if we can develop this community of practice to support GPs and paediatricians and psychologists via case conferences, secondary consults, and with the wonder of all moving to telehealth, we can start to do this as co-consultations. And I'm fortunate enough to be part of our college's advisory committee to the federal government about telehealth and how to continue that post-COVID, which will be important for these sorts of models. And I think if we can do this and bring this together, we'll have a real opportunity to evaluate the impact of this from the clinician and family perspectives, but also look at the rate of change in mental health presentations to hospital emergency departments pre and post existence of these hubs and this model of care. So in the meantime, for those of you who are, concerned about or worrying about, people close to you and children close to you, we do have a lot of resources supporting their mental health. Much of that is on the Royal Children's Hospital Kids Health Information website, our series of podcasts, the Raising Children Network website, which the Centre for Community Child Health here at the hospital is part of, also has a wonderful array of information. And then there's more, general helplines, etc., that are worth listening to and looking at. Thanks, Sue.
Thank you, Harriet. That is incredible. Thank you so much for such a thought-provoking presentation. I'm sure everybody, you'll have lots of questions that you'd like to ask Harriet, so we'll get to that shortly. But first, we just want to change it up a little bit. I mean, we always want to show you the impact that that you can have here at the hospital specifically, and that's the sort of work that Harriet's talking about. But we also thought, because of the folks that you are and the challenges that you're going through right now, you'd like to hear from a peer. And so we've asked Tristram Gray from Kmart to join us today, and he's going to talk to us about mental health in the workplace and how Kmart are managing this. It's incredibly important for all of us who are running organisations right now to have this, to be thinking about this. And I know Tristram will be able to really give you some incredible tips. Just before I ask him to speak to us, I'm just going to adjust that. I'd just like to thank Tristram, and on behalf of Kmart, particularly for the incredible partnership that we have. Kmart have been supporting this hospital, particularly at Christmas time, for over a decade. And Christmas wouldn't be the magical place at the hospital that we create without the partnership that we have with Kmart. It's going to look a little differently this year, but we're very pleased to say that the Kmart Christmas tree will in fact be able to be installed here at the hospital. And so whilst it's not the most important of things for any of the children who are in here at Christmas time, being able to have some sort of sense of normality is really important, and Kmart have been able to do that for us in great partnership for many years. So thank you to Kmart. And Tristram, I'd on that note ask you to take us through your presentation. Thank you.
Thanks so much, Sue. And first of all, pleasure to be here. And also, I'd also like to acknowledge the traditional owners of the land on which we're meeting today. For those of you who don't know a lot about Kmart, just a couple of simple stats at the front end. So we have over 260 stores across Australia and New Zealand, and we employ 38,000 team members across our Kmart business. But I guess taking the youth or mental health slant, actually 31% of our team members are under 18 and 72% are under the age of 25. So that means about 27,500 of our team are under 25 years of age. And as we know from all the studies that have been done, the mental health challenges that our youth face are quite significant and have been increased, I guess, during the period of COVID, as we've just heard from Harriet. So a couple of years ago at Kmart, we were analysing our engagement survey results, as well as, I guess, bringing together some of the anecdotal feedback we were getting from team members, from managers in our stores. And mental health had started to appear as a very strong theme across our business. So what we thought about around that was, well, we didn't really have a strategy around mental health, and it wasn't something that we'd looked into deeply from an employer perspective. But given the weight of comments that we'd received through our engagement survey, as well as a number of anecdotal comments, we undertook as a leadership team a number of listening sessions across the country in all our stores, and they were led by the managing director, myself, and a number of other leaders of the business to get direct feedback personally from team members, from managers right across the country. And again, the most common theme related to mental health, which was both surprising but also concerning for us. So what we did out of that was we decided we needed to develop a mental health strategy, and that had three core elements. The first being that we wanted to prevent harm to any of our team members. We wanted to intervene early because, again, if we were able to intervene early, we felt there was a much better chance of success or avoiding problematic elements of mental health impacts. And lastly, we wanted to support recovery for our team members. So we looked at a range of different issues, and we used a psychological risk assessment approach to do that. The key areas that came out were occupational violence, and I'll talk a little bit about that later, but some of you may be aware the increase in threatening situations in retail stores has dramatically increased over the last 4 or 5 years. Work pressure, of course, was another area, and an element around bullying and harassment was also coming through, combined with fatigue. So they were the areas that really came out and we wanted to address. So we developed a strategy around that. What we found out pretty early on was there was no silver bullet. So it wasn't like one thing that we could magically change was going to adjust everything for our team or support our team. We understood we've got a variety of demographics from the young 15-year-olds right through to 60, 70-year-olds as well. So one size fits all was certainly not going to work. So we came up with 6 elements to our strategy. So perhaps if we move to the next slide. The first element was around training. And what we did was we introduced a mental health awareness training for all of our line managers to make sure they were able to have, and supported by tools and processes, to have meaningful conversations with their team, particularly through the pandemic period. We then knew during the COVID-19 period, which I guess we're still living the tail of at the moment, but certainly in those early days, we knew there was such an increase in uncertainty and ambiguity for our team members, both in terms of what was happening at that present time and what may happen, particularly with the insights that we'd seen out of Asia, but also Europe, and how the virus had developed there. So there was a lot of uncertainty, and we knew that was creating some stress and anxiety for all members in our team. We tried to address the anxiety that was associated with financial stress, because if you recall back in early March, there was lots of doomsday forecasts around people were going to lose jobs, businesses were all going to shut, etc. So what we did was we put in place 2 main elements that I think had a large impact on reducing that stress for our team members. First one was around, we said, for anybody who had to quarantine or isolate as part of potentially being infected or being a close contact, we said we would pay you for 2 weeks pandemic leave on top of sick leave. So people didn't have to dig into sick leave as part of that. But that was particularly important in our business, where over 60% of our team are casual employees. So they don't have any access to sick leave. But what we did was we said, we really want you to be able to isolate and take that break, because we didn't want them to come to work and potentially spread that issue, but also we didn't want them to feel they financially needed to come to work in that situation. So we made sure all of our team were compensated in that regard. The second element that we put in place was that we ensured that where we had a situation, particularly in Victoria, we also had the same situation in New Zealand and also northwest Tasmania, where we were unable to provide meaningful work for people, either that we had a shutdown due to an infection, or restricted work hours, as we then found out we had in Victoria, where we had to close all of our stores, and Metro stores were closed for over 12 weeks. For customer traffic, we moved online, but there was a situation where team members weren't necessarily going to receive their normal shifts. So what we made the commitment was that all permanent staff would be paid for their normal roster if we were unable to provide that work for them, and casual staff who'd been working an average of 12 hours a week would receive their normal pay, regardless of whether we could utilise them for work or not. And I think those 2 elements really took a lot of financial stress out of our workforce. So we were pleased as an organisation to be in the position to be able to fund that for our team. The other aspects we delivered was also a team member version of the mental health awareness program, which we delivered in over 140 times across the country. 1-hour sessions, short and sharp, but also to demystify, but also to take away any stigma associated with mental health, and that was okay to not be okay, and to raise that with your manager or with your team. Very well received by team members, and very consistent, strong feedback. We also looked into the World Health Organization's approach to psychological first aid, because we wanted our managers to feel empowered to have conversations with team members, but not necessarily own the situation. So what I mean by that is we gladly acknowledge that none of our team are trained psychologists or clinicians. in any way, but the role that they could play leading up to a point where they could support team members in a way that was meaningful, in a way that they felt confident about. So the first part of that was having a 3R formula that we called it. One was recognise. So that's about how do you recognise when there's been a change in someone, in their behaviour, in the way they show up, in their attitude, in the way they're conducting themselves. React. So let them know that you're there to care, and that if they want some help, you're there to listen and to be there to be supportive. So that you acknowledge that situation. And the last element was refer. So that was about the element of, again, not owning the situation. We recognise our team and our line managers are not psychologists. So how could they help refer them, and where to refer people to if they needed assistance? As I touched on before, unfortunately in the retail environment, we've had a dramatic increase in threatening situations in stores, with violence being occasioned on our team members by our customers, whether that be verbal, confrontations, or indeed, unfortunately, physical confrontations where our team have actually ended up being assaulted a number of times. And unfortunately, this has been increasing. That issue in itself has caused a lot of mental stress for our teams, those who were in fact involved in such an event, but also those who had witnessed an event or were helping a team member deal with that. And if you recall, we've got 27,500 of our people under 25. They're not the most experienced team members. They're not experienced in life, and dealing with some of those situations can be very, very confronting and a big challenge. So we spent a lot of time training our team on how to deal with those situations, what actions to take if someone was being aggressive with them, whether it be verbally or physically, and also trained all of our store managers in how to support teams and how to react in such situations to not escalate an issue, but how to try and diffuse that, but also then how to support our team going forward. The other area that we really focused on was around our employee assistance program. So we'd been working with an employee assistance program for a number of years, but it was probably below the average. It wasn't being utilised a lot. So we had a big drive around encouraging and promoting our EAP service to team members. And what we've seen over the last 12 months as we've implemented our strategy is a doubling in the use of our EAP service. So we see that as a real positive. That people are actually utilising it rather than it being underutilised. So we see that as a sign that it is seen as a benefit, and it is seen as something that is worthwhile and beneficial to team members. It's also provided to team members' families as well, so they can access it. Interestingly, what we found in the reporting, but of course, everything is confidential, but in terms of the themes through there, 98% of the calls that go to our EAP service are non-work related. So we totally understand now that not all the issues are coming out of the workplace, but there's a lot of issues that our people need to deal with in their lives, just generally. So we're very happy to be able to provide that service to help bring our people to work in a healthy and safe way. We also introduced a toolkit called the Healthy Minds Toolkit. You can see on the graphic there. That's really a mental health handbook that team members are encouraged to take home, to read. It's a toolkit that helps them understand more about mental health, the importance of mental health, but importantly, what are the resources that are available to them, whether that's Beyond Blue, whether it's Lifeline, some of the other organisations that Harriet referenced in her presentation we've got there, and how to help someone or support someone who might be struggling either in your family or in your work situation. The other thing we did was for our office staff is we found that a lot of people in our national office, where 1,000 people sit at Mulgrave, and a lot of them weren't taking breaks. So they weren't taking their lunchtime, doing the classic work through lunch. I'm sure many of you do the same thing. But what we thought was important that we introduce a break. So we introduced a concept called U-Time, where we blocked out everybody's diaries for an hour between 12 and 1 every day. No meetings are allowed to be booked during that time. And we also run sessions around yoga or meditation to ensure people have got an opportunity to take a break from work or take a break from their screen, go for a walk, eat their lunch outside, those sorts of things, to try and make sure that they get that break between work to reduce that element of fatigue and hopefully reduce a bit of the pressure that exists in all of our lives from a work perspective. Importantly, our leadership team did this as well. So this wasn't something for the masses, if you like. It was led and owned by the leadership team, because we felt it was an important leadership issue. If we didn't do it, it was going to be pretty hard to ask or make it important for the rest of the organisation. So all the leadership team participate as well. If we move to the next slide. The element we also brought in was the importance of being active. So everybody we talked to around mental health in the medical fraternity and sporting communities stressed the importance of keeping active, and its importance and its impact that it can have on mental health. So we introduced a number of activities and initiatives, and we participated in a number of fundraising events. So we participated in September. We participated in Are You OK Day. We're currently participating in Movember to try and get a bit of a healthy competition and challenge for our team to go out there and do some things active, to keep their bodies active and to keep their minds active, because we understood the massive benefits that provided. If we just move to the next slide, just some photos of the guys and the big participation. So this not only happened in our offices, you can see here, this is all around the country, out in stores, and our team really embraced it. And to some extent, we're a bit overwhelmed by how engaged our team were around this and what an issue it is out in our business. And it was great to see so many teams across the country participate in these initiatives. The last thing we did was we've established a whole governance process and system around mental health. So we've established a mental health governance steering committee, which has got a number of us on the leadership team. Myself, the managing director, the CFO, head of corporate affairs is on that committee, and we oversee and drive direction and lead and take away barriers to anything that the committee, which is made up of team members from various levels across the organisation and various geographies across the organisation, who investigate, survey, look into the types of issues that are coming from our team, and then look to introduce initiatives, policies, processes to then address those elements. So it's driven from grassroots up, but at the same time, it's got significant senior leadership endorsement and sponsorship to drive actions and to remove barriers or potential barriers from initiatives being implemented. So we felt that that's really paid dividends for us. Of course, you know, the last thing I'd say to you is that we're perfect or that everything's fine now. It's not. We understand that this is a work in progress. It's something we're constantly having to focus on because of the demographics we have in our business and because of the importance to both our team members, the communities we work within, but also given the age demographic that we have, as I've touched on, a lot of parents want to, and we need to make sure that we're providing parents with that reassurance that as an employer, we are there to help support their kids when they're working in our stores. So that's tremendously important to us. So we continue to monitor as we go forward. We adjust, we benchmark our performance, we benchmark the issues that are coming up, and we adjust our focus based on the issues that are coming through, but really based around that whole strategy of those three elements about how do we prevent harm, how do we intervene early, and how do we support recovery for our team. So I might pause there, Sue, and hand back to you.
Lovely. Thank you so much, Tristram. That is absolutely incredible. I find that really, really interesting presentation, and to make something so incredibly practical out of when we've heard a lot of the data, albeit for young people, to hear also how it translates into practical is really interesting. You said something about how you're surprised at the incredible response from your team members for the U time and for the fundraising and for their level of engagement. Having seen the Kmart partnership at work here at the hospital, I don't think you need to be surprised at all. Every year when we put the Christmas trees up and put the small trees up in the wards and everything, there's a huge mob of Kmart people come in on that Saturday to help install them and put them up, and the level of kind of enthusiasm and engagement to be part of their community, which this is, as well as all the other ideas that you're talking about there for cerebral palsy and Movember and others. So I don't think you ever need to be surprised about the level of engagement that Kmart staff have, because it's palpable and we see it every year. So thank you so much. Ladies and gentlemen, now's your opportunity to ask questions. I'm sure you've got two incredible experts in their fields here, and I'm sure you'd love to ask some questions about it. While we've got a few of those coming through, and while you're thinking about it, just so that we keep things moving, I'll kick off with the first question. Harriet, you talked about the mental health strategy across the campus. Can you tell us why you think it's so important to have the three institutions, the hospital, the Murdoch Children's Research Institute and the Department of Paediatrics at Melbourne Uni, working together on the strategy?
So I think it's quite a unique opportunity. I think it's because they're all parts of a jigsaw puzzle. And if you just have one bit, you're not going to get anywhere towards a solution. So we need clear guidance on good practice and what good clinical care is, help for, as I said before, for parents, GPs to know if it's a problem or not, then know about referral pathways, a bit like Tristram was talking about. Where do I refer you? What do I do? We also have issues with behaviours of concern, we call them. So aggression, in the hospital, which I didn't touch on, but we need staff training around that because kids can get frightened and aggressive and parents can get frightened and aggressive. So there's work around that and the clinical care, but then you need to train your staff in that and educate them. And we've been really good at training our staff in world-class physical care management. But I think we haven't had quite the same focus on mental health as we've needed, and that's coming up. And then underpinning that is you need to have evidence-based information. So if you go online at the moment, you will find thousands of cures for anxiety, depression, ADHD, autism, many of them with no evidence base. And the worst, the least harmful thing is someone spends time with that and it doesn't work, but it can cause harm and it often comes at a financial cost. So we need to continue to build the gold standard evidence that then feeds into our clinical practice, that then feeds into our education and training. So it's all part of a circuit, really, I see.
Yeah, thank you. Yeah, that's really well put. There's a comment that's come through from one of the folks on the call, and that is that he's not aware of a program of philanthropic support specifically about mental health here in the hospital yet, or for research into children's mental health, and how well supported he thinks it would be. And Harriet and I both know that what we're working on, putting that kind of full picture together. And then when we have got that full picture and understand how we could stage it, we do want to speak to our supporters quite directly about how we can do that. There'll be a role for government in helping us achieve that gold standard, and there will be a role for philanthropy as well. And so to Ken's point here, we hope that once we've got that blueprint, once we've got that evidence base, and once we know what our early interventions ought to be, that we can go to donors and say, help us to achieve this alongside government.
Yeah, and I think that's pretty close. We've actually consulted with over 60 staff here on campus to develop the strategy. So it's been a really lovely collaborative piece of work. Yes. And I think the time is right. People are passionate about doing this better. And, as Sue knows, we've got a 98-page blueprint behind it all, but we need to, pull out the pieces from that. But absolutely.
Great. Thank you. Tristram, I'm going to throw to you for a question. What do you think is the one thing that you're going to take away from this year about how to best care for and manage the team at Kmart?
Yeah, I think the thing that's come out this year is just the simple things, I think, Sue. So I think it's about not trying to over-engineer things, but just the simple asking people how they're going in a non-work related sense. So I think we're very good in businesses about how you're going with that project or where you're up to with that particular initiative, etc. But I think what's really valuable, and our team have told us is really valuable, they really like it when their manager, particularly when we've been working in quite a remote scenario for such a long time, just gives them a call, not for anything related to work, but just to see how they're doing. What's happening on the weekend? What did you do last night? How are your kids? Etc. Those sort of things make a huge impact and really demonstrate in a tangible way that people care beyond your role as an employee. So I think it's about people being recognised, but also just asking people how they are, whether it's your peer, whether you're a manager, whatever. But the one thing I think is just engage with people at a human level, I think has a huge impact.
Sure, Harriet.
Yeah, Tristan, I have a much smaller team of 20 people that I've been managing throughout the pandemic, but I think in addition to that is giving them permission to say I'm not okay. And I recall one time early on, we were on one of our Zoom meetings and we said, just put in the chat how you're feeling. And all these adjectives came out which I didn't realise, angry, frustrated, helpless, hopeless. And then I started talking about how I was feeling, and then we really had a frank conversation. So I think exactly asking how you are okay, but also telling them how you are, which gives, staff who often junior staff may not feel they can do it, but permission to say how they're really feeling. Because there's a temptation to say, are you okay? Yeah, I'm fine.
Yeah.
It's still a hard thing to talk about.
And I think it's particularly when you're in a 2D situation as well.
Yes.
It's hard enough when you're
face to
face, but then you've got a natural barrier that's there.
Exactly.
How do we encourage those conversations, at a broad level or an individual level?
But I think that's the silver lining of this pandemic is we have focused more attention on this, and I think it's slowly breaking down some of that stigma and barriers to say, actually, I'm not okay.
Yeah. I noticed on one of Tristram's slides, the I'm grateful for. We spend a lot of time talking about gratitude, whether it's gratitude from our donors or whether in the foundation, whether it's what we're grateful for as individuals and the foundation as well. And I think it's also that notion of kindness that we've seen so much pop up. People, wonderful things on social media around kindness, and that really resonated when Tristram, you were talking about had no idea that retail environment would be so highly charged. We have what we call code greys here at the hospital, where things that's unarmed conflict, and we have a lot of them in a lot of different environments. But it's made me write down a little note here. We've got a retail environment here. We run our gratitude hub, and I just sort of thought, I wonder how across that kind of code grey connection and things are we. So thank you for that, because I had no idea. But that notion of kindness that's come out. Let's just hope that continues on. We have thanks so much, Kristen. We have a question from Anna, which I'm going to direct to Harriet, which is, what role does social media play in children's and young people's mental health?
A massive role. I don't know if anyone's watched The Social Dilemma, which is quite interesting, I think, in that. Look, it's pros and cons, but I definitely think particularly young girls, but also boys as well, are just prey to this whole social media stuff. And whereas before, bullying's being a big issue, it used to just be during the school hours, it's now 24/7. So I think it's having, again, a conversation with your young person. If, phones are a part of life, that's fine. How do you go off the phone? How do you unfollow someone if they're being awful, defriend them, whatever else you need to do? There's good apps now to actually, ironically, take you off social media for a period of time. Some of them, and particularly girls like this, is the amount of time you spend off, you fund planting a tree somewhere in the world. So I think there's creative ways of doing that. Yeah. So social media can connect, but it can also be really damaging. And it's really being aware of what your kid's doing on your phone, which gets really hard as they get older. But having a conversation with them, how do you feel? Does it make you feel better? Does it make you feel worse? If it's feeling worse, what can you do instead? Let's get outside. Let's go and do something. Yeah,
great. Thank you. And then just continuing on, slightly different tack, but from Shelley, coronavirus has exposed children to the idea of death perhaps earlier than ever before. And has this caused a lot of fear and anxiety for children? And has this also changed the way of thinking about how we approach the concept of death?
Yeah, look, I think that's very interesting in Australia, and it's quite culturally dependent. The traditional sort of white Anglo-Saxon person doesn't do death very well. We don't talk about it. We don't celebrate it necessarily. I think it's been a mixed bag for some children. Some children are fine, but some with pre-existing anxiety tendencies have certainly been really worried about it, particularly in the earlier phase and during lockdown. I'm seeing they're coming out of that now, so they're more reassured, but they're a bit scared of going back into the world and catching coronavirus. So there has been definitely some impact on some kids, but not all. I don't think it's shifted yet, how we manage death and talk about it. And I still think that's quite bound up culturally or, depending on your religion. Yeah. So it's a much greater thing.
Thank you. And from Ken, for you, Tristram, I hope we've still got you there. Is the fear of job loss a major factor affecting employee mental health?
I think, Sue, certainly at the beginning of this crisis, that was a big issue, which is part of the reason why we put in place the financial support that we did around supporting our team. I'm really, really pleased that during this whole crisis, we haven't had to let one person go. As a result of that, we've maintained employment for everyone. And as I said, even in the situations where we were not able to utilise our team members fully, we continue to pay them during that period because we understood what an impact that would have. So I think that took a lot of stress out of our workforce. I think, however, people still do look around. I mean, I think the figures are around an extra 1 million people unemployed in Australia today compared to previous. So people see their friends. I don't think there's anybody, myself as well, friends of mine or people I know or through family who have lost their jobs. So I think there is an element that despite whatever we do within the organisation, the external macro environment still has an impact on people, and there still is an element of that concern there. So we've just tried to do everything we can to try and control that internally in the organisation. However, I do think it still affects people in the broader community. Absolutely.
Yeah, absolutely. And we won't know how much for and how long right across the life course, will we, for a long time. Harriet, where do we go to from here? What do you think is the one thing we could start doing tomorrow to improve children's mental health?
That's always a fabulous question and a big question. I think it does come back to the simple things of prevention. And Tristram talked about activity, and I would add sleep and diet to that. So particularly with social media, sleep is often impacted because kids are up on their phones all night and things are pinging at 3 a.m. But we know from a lot of the research we've led here that a lack of sleep and poor quality of sleep is associated with anxiety and depression. So getting out, having a structure to your day, doing some exercise, whether that's a walk around the block or something more than that, getting enough sleep, and that old sort of, not very sexy thing, but eating well. So they're the simple things. At a systems level, I really do think ultimately we need more workforce in children's mental health, but that takes time to train people. So that's a long game. The short game is how do we support our GPs, paediatricians and psychologists in the community with those sort of community practice education models that I've been talking about to really upskill them so they can hold on to the mild to moderate mental health problems and stop the huge sort of influx into our emergency departments and our public health mental health system, which has just got really long waiting lists. So if we can go a little bit upstream in prevention, and then if those kids have got mild to moderate mental health problems, helping them so they don't progress to that really severe end, I think that would be a fabulous thing we could do. Yeah.
Right. And just sort of another question that come in that's kind of related to that. I'll reframe the question slightly, but in terms of that health promotion message for young people, during this year of COVID or 150th, that notion, we talk a lot in the hospital. We promote healthcare. Yeah. But what about health promotion? Do we have a role? Does the hospital have a role in that?
Absolutely, we do. And unfortunately, prevention and health promotion is not very sexy. That's one of the issues. It's, I hate to say, but if you have a child who's really unwell, that's an issue, and that's in some ways far sexier than talking about the things like getting out, being grateful, mindfulness, etc. I think we absolutely have a role for the child in front of us and the parents in front of us, because your child's only as happy as you are happy, and you're only as happy as your unhappiest child. So we've got to think of this as a family sort of response, and we can definitely play a role in doing that. And I think through the poll, we often do that as well. We get those messages out.
Yes, indeed. Yeah, the polls are incredibly important. Yep. But we're coming up to time, and we don't have a long list we don't have any other questions there, but we did have a lovely comment which has been taken off the screen, but it was a comment from one of our supporters who just wanted to say how much she enjoyed presentations from both Harriet and Tristram, and to learn and to see that. So thank you, been put back up. So important for us to know, and it's so easy to be negative when we're not doing what we usually do. So she loved both presentations and congratulate both presenters for making such an impact during a challenging time. So Tristan and Harriet, you can feel well loved and great gratitude from our supporter there. So thank you everyone for those considered questions, and thank you Harriet and Tristram for such interesting presentations. So I think this year has shown us many things, ladies and gentlemen, hasn't it? But one of them is just how important connectedness is, and how much we value and need our family, our friends and our colleagues. So important that we all take care of our own mental health and that we look out for each other, that kindness that I was talking about before. So there are many opportunities to support the vital work that Harriet Hiscock and her team are doing So if anyone's interested in supporting mental health at the RCH, please do get in touch with Kate, and we'd be more than happy to speak to you about how you can help us achieve that gold standard that Harriet's talking about. This year is also, if you've missed it, it's also the 150th anniversary of the Royal Children's Hospital. And that's a momentous occasion in any man's language. So we had planned a year-long program of events that we haven't been able to deliver, of course, since March. But we did want to make sure that we give the hospital and you, our wonderful community of supporters, the anniversary celebration it deserves. So we did what everybody else has done. We've pivoted. We've gone digital for most of the year, and we hope to come back next year with a range of events in real time here at the hospital. But two of the cornerstone events that will take place next year is the RCH 150 anniversary dinner and me and you, the RCH 150 anniversary art trail, both moving into 2021. The anniversary dinner is going to take place in June, and it promises to be a wonderful evening. There's still some tables available to purchase, so if you're interested in joining us, please talk to Kate again. And the art trail is going to take off in January, and it's going to showcase our state's artistic flair. It's going to engage our community. It's going to celebrate 150 years of the hospital, and hopefully it'll raise some money as well. It's 100 sculptures that will dot around the cities of Melbourne, Moonee Valley, Stonington, Port Phillip, and the great city of Geelong. 100 sculptures called UU, each individually designed by an Australian artist and generously sponsored. They're going to find their way into laneways, streets, parks, public spaces. They're going to form great walking trails throughout Melbourne and Geelong. They're going to bring our community together. They're going to give you the opportunity to be active. They're going to be the opportunity to be creative and to have some fun, all of which we need to do so much more of. So we're fortunate to have some of our 150 supporters with us this morning, and thank you so much for joining us, and thank you for your ongoing support. There are just a few UUs that still need a sponsor, so please speak to Kate if you would like to get involved in such a wonderful event. There's lots of promotional activity and possibilities, lots of great opportunities for you to be part of a terrific event. So please talk to Kate if you need further information. And as we celebrate that 150 years, I think we would always say that we're so fortunate to have dedicated and committed supporters like all of you. And the support that you have for the hospital is really ensuring that the RCH and the Murdoch Children's Research Institute and the Department of Paediatrics are at the forefront of paediatric healthcare. The Melbourne Children's Campus would not be what it is today and the aspirations that it continues for tomorrow without the support of all of our partners. We're so lucky to have this great hospital here in Victoria, and it's largely due to philanthropy and the support of people like you. So thank you, everyone. This brings us to the end of our virtual breakfast. We just have one more little treat for you to finish off the event, and that is we wanted to share with you one of our UU artists, Trisha Vanderkype. Trisha is a proud Wiradjuri woman and a mixed media artist. She's known for the use of her colour and whimsical art. In 2019, she became one of 8 Victorian artists to have her artwork displayed on a Melbourne art tram, and we've all seen those. She's produced award-winning skateboard art and her own distinctive colour book range inspired by her Aboriginal heritage. We're absolutely delighted to have Trisha featuring in the art trail, and we wanted to give you a little sneak preview and to have you hear from Trisha about just how she's engaged with her UU and this art trail. So it's a pleasure to have you join with us. Please enjoy this video, and we look forward to seeing you again super soon. Thanks, everybody. Bye-bye.
So my UU features koalas and ice creams. And given this year that the bushfires, the koala population has been really heavily hit. So I think we need to keep reminding ourselves about how awesome these animals are and how iconic they are to our country. I'm really proud to be involved in this Royal Children's Hospital project, me and UU. I went to the Royal Children's Hospital when I was a kid quite a lot. So I'm really proud to be associated. I have only good memories of how wonderful the doctors and nurses were to me and my family. And I just feel like this is a really great way to celebrate them. I'm really looking forward to seeing the Me and You art trail. There's so many amazing designs. I keep seeing them pop up on social media and I am dying to track them all down.